do you have 5 top tips that you would give to an owner who's just found out that their dog has, let's say, quite moderate to severe arthritis?
The five tips are, I'm a firm believer, by the way, is get into a physiotherapy exercise program. I think that's absolutely important, and it's something that you guys all need to do regularly. So they're getting the owners involved in it with the pet, and they need to be part of that exercise program that is there. And I think getting that to work is one of the first things that are important. If they are overweight, that includes weight reduction in the whole exercise that is there. And those, to me, if you look at, by the way, strength of evidence has been consistently shown, even in veterinary medicine, to be beneficial. So, and there's a number of studies that support it. So for those owners, that's the first thing that I always suggest to them. My next suggestion is, and people have this natural tendency to go to Dr. Google. We all Google everything, by the way. Just remember, the more opinions you find, the more divergence you're going to find. And actually, the tougher you are going to make your decisions in life to do that. I'm not saying don't go and do some research on the internet, and it's fine. I love reading divergent opinions because I think it helps me in realizing what all the grayness is and different points of view are.
Yeah.
But it's important to settle on a plan and to follow through that plan and give that plan a reasonable chance of working. Sometimes you don't see an immediate effect on the first day, but to work through that plan with the people around you, even though you may know that there's other plans, what the other ideas do give you is when things fail or don't appear to work, is there are other things that you can utilize. So to me, that's very, very important. And as I say, it's about asking for evidence, but look at how your pet responds.
Yeah.
It's about how your pet individually responds to those therapies. So although the theory may be great, not all patients read the textbook, as I always say, but it's about what makes the biggest difference in that pet's life. And often that's going to take some trials of using different things to find out what is the perfect combination to work. So I always ask people for patience and understanding and education. Give them the information they need to know about different types of therapies. Why are we trying this? What we expect to happen? How long it's going to take to have an effect? And so, for example, some of the drugs we use, the best effects may only be seen in 6 weeks. If you expected it to work on day 1, you're dismally disappointed for 5.5 weeks before you start to get the best benefits, if I can put it that way. So that education understanding is absolutely vital about it. And I say to people, if you have questions, ask. Go, if you've read stuff, ask, because I may not do something because I may have a very specific reason. I may not have told you why I just totally discounted this in my whole thinking process without mentioning anything to you. So ask questions, not because I'm trying to hide you. And as I always tell them, this is a trust relationship. We're in this for the next couple of months to years, and we need to be able to work together to get through it. So it's an important trust relationship that we build. And the last thing is, always tell people, I always give them advice looking for, call it adverse drug side effects, all those type of things that go along, vomiting, diarrhea, they can happen because of a host of things. Usually it's worthwhile stopping your medication and seeking veterinary advice. Maybe we'll carry on with those drugs. And I've been involved in trials, for example, with non-steroidals where we've watched liver enzymes for over a year. We find liver enzymes go up 1 week. We retest it 2 weeks later, it's back to normal. We've actually continued the drugs in the trial through these type of things to see what would happen. And as if people own cats, they'll know cats get fur balls and they pick up a fur ball every now and again. And I always say to people, if they have had cats, what's the chance of your cat vomiting up a fur ball today? Most probably not very great. But what's the chance of your cat having a fur ball over the next year? And the answer is very great. It's very likely to happen. So as we give drugs over long terms of effects, we're likely to see what we would call side effects. Vomiting, for example, a diarrhea episode, etc. Could be from the drug, but it could also just be from picking up a virus in the park, and a whole host of other things to it. So it's about having some sensibility to realize you are going to see these things. And if, for example, you've been to one of the hate websites, you'll see this, it's a drug, it's killing my dog. there we go. That's it.
Yeah.
And to realize that it's not always what it seems to be, and that takes understanding to do it, to be aware of it. I think creating what you said, like pain diaries and good days, bad days, is always useful because it helps us make longer term decisions that are there in those patients.
Yeah,